Looking from the outside in, you can never understand it. Standing on the inside looking out, you can never explain it. People struggle to deal with mental health issues, and therefore treatments become readily available to overcome their battle with their disorder. Over time, doctors began developing treatments that are more beneficial to patients who strive to conquer their disorder. There are many different types of treatments that are given to people with mental disorders. The three most important treatments are usually brain stimulation, medication, and psychotherapy. These treatments are ways that patients can overcome their disorders. Overall, these treatments have positive effects on people, but sometimes they do not work.
Brain stimulation therapy, or electroconvulsive therapy, is one treatment used to stimulate the brain with electricity. Patients who have severe depression, bipolar disorder, or schizophrenia will most likely be given ETC to treat their condition. They also may be given ETC if the patient cannot move or respond to reality. If other treatments such as medication or psychotherapy do not work, brain stimulation is recommended if the patient's illness does not improve or gets worse. To begin the procedure, the patient is sedated with anesthesia so they will not wake up. They are also given a muscle relaxant so the medical team will be sure the patient will not move during the procedure. When the procedure occurs, the medical team starts off by placing electrodes on a specific location on the head where they are targeting. When they shock the patient with electricity, an electric current passes from the electrodes through the brain, which causes a seizure that lasts less than 1 minute. During this procedure, the patient does not feel anything due to being under anesthesia and has taken a muscle relaxant. After the operation, the patient wakes up in 5 to 10 minutes. They may usually feel disoriented, but after an hour, the patient can go back to doing normal activities. For the patients to improve their depression, brain stimulation can be given 3 times a week. If a person undertakes this operation, they will be given some sort of antidepressant or mood-stabilizing medication. Some people may worry about ETC because it can cause memory loss and confusion for the patient. Another method of brain stimulation therapy is vagus nerve stimulation. VNS is when a medical professional implants a device under your skin that sends electrical impulses through the left vagus nerve. This nerve carries messages from the brain that controls mood and sleep. Doctors use this type of brain stimulation because it has effects on mood and depressive symptoms. The pulses from the device can change certain chemicals in the brain that controls mood. People with depression might get the surgery to help their disorder become less severe, but sometimes VNS might not be the safest. A woman named Kelly Ellison went through VNS to treat her Parkinson's disease. She had a small battery device that was implanted in her chest and a wire that was connected from her skull to her collarbone. Things did not go so well. In June 2006, the part of the electrode outside Ellison's skull came loose. Not long thereafter, the battery inside her chest wall suddenly dislodged and fell into her hand while she was toweling down after a shower. Ellison had to undergo another procedure. She describes the second time around by saying, "It was like somebody had struck a match to my brain. I had no numbness whatsoever in my scalp and I couldn't speak." Overall, brain stimulation can be good, but sometimes there can be complications.
Just like present day, the patient consults with a doctor to determine the medication necessary for their illness. Antidepressants are a common medication to treat depression. This medication is prescribed to treat anxiety, pain, and people who struggle with emotional issues such as depression. One may respond differently to every type of antidepressant. It is important for the doctor to administer the drug constantly within a rate 4 to 6 weeks. Symptoms of depression might appear again if not taken properly. Some people experience side effects which include nausea, vomiting, weight gain, and sleepiness. Mixing antidepressants with triptan medication can result in the death or illness called serotonin syndrome. Medications might not be effective to patients at all. The National Institute of Mental Health says it is important to know that some people may not feel better with the first medicine they try and may need to try several medicines to find the one that works for them. Others may find that a medicine helped for a while, but their symptoms come back. Medication such as stimulants have a positive response to people who are dealing with attention and alertness issues along with high blood pressure. Stimulants such as methylphenidate and amphetamine are used to treat ADHD. This type of medication is intended to calm the individual and is made for the patient to focus better. However, there are negatives to this type of treatment, which includes difficulty sleeping, stomach pain, and headache. Dementia, eating disorders, serious depression, post-traumatic stress disorder, anxiety disorder are serious mental illnesses that antipsychotics help treat. People who lose touch with reality take this medication to enhance their quality of life. Commonly epileptics include chlorpromazine, haloperidol, and paraphenazine. Many of these medications are used every day for patients who suffer mental health.
Psychotherapy is another option of treatment to personally talk and help overcome a patient's disorder. Talk therapy can help someone that is dealing with problems at home, problems with troubling thoughts or emotions, or can help to identify someone who has lost their sense of reality. Patients talk to licensed medical professionals who have meetings to talk about their struggles. Talking with a health professional can help people diagnose what condition they might be dealing with. Once there is a diagnosis, a doctor can give the patient medication to deal with their disorder. For example, in class we watched the movie Antwone Fisher. Antwone went to seek therapy for his bad behavior in the Navy. As we watched, we learned that he went through traumatizing experiences as a child, which led him to act the way he is. Antwone's psychotherapy helped him move on from his bad experiences. In conclusion, psychotherapy can help people talk about their disorders and conquer it.
Brain stimulation, psychotherapy, and taking medication specific to an individual's disorder is vital to treat mental illnesses. Brain stimulation is one way that doctors can help treat some mental disorders, specifically targeting depression and schizophrenia. Medication is also another helpful method in treating mental health disorders, commonly known for depression. Last, psychotherapy can help people cope with their problems and illnesses. Overall, these methods were the most efficient in traditional treatments.